Hello, everyone, and thank you very much for joining us today. I'm Deborah Garlick from Henpicked Menopause in the Workplace and Menstruation Friendly, and I'm delighted to welcome Kate Muir. Now, honestly, Kate, I am fangirling you. We've got Kate to thank for the Davina program on menopause, lots of books, and one that was about the pill. And when we were talking last time, you were talking about your book, your new book. Oh, it's not a new book. You'll have another one coming out very soon.
Mm.
Your book on the pill, and you were telling me some remarkable insights. And one of those was, does taking the pill affect your mental health? How do hormones affect your brain and your menstrual cycle? And I was absolutely fascinated. So thank you very much for joining us today
Thank you.
and
It's great to be here.
helping us understand what this actually means. So the pill, menstruation, and menstrual health, what have they got to do with one another?
Well, I suppose it's all mental health. And what we have to realize is, of course, that hormones don't stop at our necks. They're not just at our ovaries. They're absolutely infusing every bit of our brains, and that hormones are neurotransmitters. So the idea that, we do something that does things to our ovaries without thinking about what it does to our whole bodies is crazy. And the more we can learn about how to harness hormones, either the synthetic ones in the pills or natural hormones, and use them to increase our kind of mental powers and not have breakdowns and not have, premenstrual tension or, postnatal depression. All these things are incredibly important. And what I didn't realize until we made a documentary with Davina called Pill Revolution, and we did a poll of 4,000 women across Britain and 16 non-binary people as well, actually, and asked them what their experiences of the pill were, and obviously other kinds of hormonal contraception like the patch and the coil and all these other things. And what they told us was that a third of people had come off the pill because of mental health reasons, because of the mood. And you know how your doctor always says, oh, keep on it for 3 months, see how you go. And people really, really had struggled and had a horrible crash early on, but had struggled on for 3 months, And I think we have to understand that if something is going wrong, it's possibly going wrong, and you should ask for a different pill or a different method. And I don't think people are told that. And because you can get the pill over the counter in your pharmacy now, aged 14, and we're talking about our daughters here too, it's not just, older women, and they don't get any advice and they get put on the bog standard pill. And, it's really kind of, there's all sorts of risks. Some pills great, some pills not so great. Depends on who you are, and everyone's hormones are different. So that's where we start, sort of thing.
Well, that's where we start. But if I take that back a little bit, because hormones and understanding that hormones have an impact on our bodies, we've
Mm,
all made such a difference with the work you're doing, with the organizations, with many individuals that will be on this call, understanding the impact on hormones while we're going through the menopause.
mm,
And
yeah.
so we're starting to hear more and more about hormones. So it is opening up this opportunity to talk about hormones
Mm.
more generally. But I have to say, uh, I understand what you're saying about the pill, but many people just think they're for contraceptions. They do a lot more to our bodies than just stop us getting pregnant.
Yeah, no, absolutely. And they don't just change things like your serotonin. You think about serotonin and dopamine, your happy hormones in your brain, and they're affected by estrogen. And of course, there's estrogen in the pill, but it's synthetic estrogen. So your own estrogen is not functioning at the same level because it's getting a synthetic replacement. And for some people, that really can lower your moods, and it does lower your mood a bit anyway. And one of the things you often find when you talk to people who've come off the pill is they have this amazing creative and energetic peak in the middle of the month, which we know from our menstrual cycles. But of course, while you were on the pill, you were flatlining, you were very steady, and that's great for some people. Some people really want that steadiness in their periods. but other people, you're losing that creative and energetic peak. And one of the other things I discovered studying like the menstrual cycle and what the pill was doing and what it was like to have your natural cycle was just that when you have your period, assuming your period's okay and not mega agony, but when you have a kind of normal period, um, that is the time in the month when you're at your most accurate. So you're doing your data or whatever, got a little bit of period pain, but you're absolutely on it and you're really sharp. And they found this out by studying female footballers, and they were really good at scoring goals when they were just had started their periods and they had that focus. And we always think of that time of the month, don't we, as, oh God, period, a bit of a struggle. And in fact, to reframe it as this is the time when I'm well organized and accurate, I happen to be having my period. That's rather wonderful, isn't it? And then to reframe the middle of the month as this is my creative and sexual peak, but it's not, intellectually, when you're firing on all cylinders, that is when, and then obviously there is the Ben and Jerry's dip at the end of the month. And maybe if you can work from home and work from the office some of the time, or, have got to schedule an exam or a driving test, you probably don't want to schedule it at the end of the month just before your period, if that, gives you a real zoner. So that's all, really interesting. And we need to start, I think we need to start embracing our hormones and controlling them rather than having them controlling us. And I think you and I know, Deborah, from our own menopause experiences, and this is how I understood hormones in the world, was that when mine disappeared at menopause, I had these incredible heart palpitations. I had memory blackouts where I just couldn't remember sometimes domestic nouns in the house. It wasn't just forgetting a name, it was really frightening. And then I got my estrogen, progesterone, and testosterone back. And I got my mind back and I stopped having heart palpitations. Never mind, your hot flushes. And so then I started looking at what was happening with younger people and how the synthetic hormones were affecting them. And I think the key part of this story is also personal for me, is that my daughter Molly was at university in Edinburgh on the pill, and it was the middle of lockdown. She was sent home with, as everybody did with COVID. She went into our basement. She got incredibly depressed. She couldn't come upstairs for her dinner. She really just was a different person. I thought, oh my God, it's COVID. What can I do? And then her pill ran out because it was an Edinburgh prescription. She didn't bother getting it renewed down here. And it was the bog standard pill, which is Rigividon or Microgynon. Lots and lots of people get it. It's the first one the NHS hand out. It's the cheapest one. When she stopped her pill, she suddenly felt great. About a month later, she bounced into the kitchen, a new person, not depressed anymore. And we sat there going, well, what's changed? We're still in lockdown. And she and I realized together the profound mental health effect that that particular pill had on her. And we started researching it, and we found all the Scandinavian research. She's a very good researcher. We had nothing else to do. And that began the book and the documentary. And there's lots of Scandinavian research showing you are more likely as a young person to go on antidepressants after going on the pill. And obviously these are big, big databases of millions of women, because of course they track everyone in places like Denmark really, really brilliantly. And obviously there aren't randomized control trials of 3 people on the pill and 3 not on the pill, but they show a huge trend of the mental health risk. And we can now see that in brain scans. We don't have to, we're not making it up. We can see how your brain changes on the pill, and we've just started to scan brains. And I just feel that we have all been wandering around going, oh, what's wrong with us? Is it me? Is it my fault? Do I feel a bit funny? And I sort of was thinking about Molly, and I thought we should be journaling and writing down when we start the pill, what we feel every day, or go on your pill app or on your, your natural cycles app or whatever it is, and put in my mood today, my mood tomorrow, my mood since I've been on the pill. Is it different? Because I think we as women sort of take it on ourselves and don't look at the outside cause. I mean, obviously, sometimes it is ourselves, but it's really, really important to question when you're putting synthetic hormones in your body, are they the right ones? And for Molly, it was the same hormone that was in the pill, levonorgestrel, that was in the Regividon pill, that is in the mini coil. And she got the mini coil, had no effect on her mood at all.
Wow.
So there is a story from my own household of, the mental health effects of two things that nobody had explained to me. And I was an expert in menopause and hormones. A bit
Absolutely.
embarrassing, but
But this is the journey that we're on, aren't we?
mm,
Because we learnt a lot around our menopause and around menopause more generally now, and some of the fluctuations around that. And I wonder if people put this in chat, how many of us had a session at school that said, "This is what's happening in your bodies. You'll have your period." Because I know certainly when we do menstruation training in the workplace, and we talk about the cycle, because
mm,
menstruation, that's the process when you have your period. The menstrual cycle is a different thing, and you explained it so well, Kate, around a good time to score for those of you that are actually playing football is towards when you might have the start of your cramps, but you are going to be scoring a goal. You're much
mm,
more likely to be on your game and really fully
mm,
functioning. But people don't realize the start that there is a pattern to your cycle. So it's worth tracking your cycle and understanding when
yeah,
you're feeling at your best and when you're not. Some
yeah,
foods, actually, some of the nutritionists will say, well, actually, there's things that you can do and there's recipes that you can do for different parts. But I never
mm.
knew any of this. I knew the bit about Ben and Jerry's just before my period because we all like chocolate and Ben and Jerry's
Yeah,
when
yeah.
coming up to period time, but you don't know why. So understanding that cycle
Mm,
is absolutely key. And as you say, if you're doing something to influence that cycle, whether that is HRT or
mm,
whether that is the pill, then you track it even
yeah.
more to understand, is it really suiting me?
Yeah. And I mean, lots and lots of women are coming off the pill now because it hasn't really been improved much since the 1960s, 1970s. And indeed, Molly was on the same pill I was on when I was at university. That's how much the advance was when you think about, we've gone from, you know, trim phones to iPhones, but yet the pill is just exactly the same. And it makes you think, well, how much do people care about women's health and improving things? But there are a couple of pills that have come through which I wanted to tell people about and actually tell people a couple of the names of the three that are available in Britain because they come with body identical estrogen in them. Now, a pill usually has a combined pill has synthetic progestin, which is like progesterone but synthetic, and ethinyl estradiol, which is synthetic estrogen. So you used to have these synthetic pills. The pill I was talking about was synthetic, and now there are three pills that have natural estrogen in them, which is the same as the good estrogen we have in HRT. So the older women have got the good estrogen, which works with the serotonin receptors, which works with our immunity, which is just basically topping up our own hormone with a copy. And that is now available in three pills, and they're called Zoe, Zoe Ly, Clara, which is spelled with a Q, and Drovelis. But particularly Zoeli, they've done some tests on that, and it has quite a good synthetic progestin in it and this natural estrogen. And they tested it on a bunch of women who had severe PMDD. So just before the last 2 weeks before their period, they had incredible kind of depression, low mood, anxiety, bloating, everything, really, really bad version. Um, and 75% on that pill felt better. And they did the sort of, the depression scale and the anxiety scale and worked out that their mental health had altered. 25% it didn't work for, but that's going to happen with any hormone in any body. But really, really interesting if you are tackling PMDD and people are giving you antidepressants, which doesn't necessarily solve your problem, which is that your hormones are going haywire in some kind of way. And the Zoeli is really interesting, but it's more expensive. It's available on the NHS, but it's about £8 a month. And the ordinary pill is about £1.50 a month. No one is rushing to prescribe you the body identical estrogen, but it's a really good tip. And it may not work out, but what if it does? And to have those choices. And the Clara one is again for people who've got heavy periods and it's got a very short kind of period break on it. I think it's just 2 days. Things like that. We should know about these wider choices, But we're not being taught, we're not being told, we're not, and I see someone putting up there, we should be taught this in schools. You're absolutely right. We should not be dissecting frogs because half of us are going to have to deal with menstrual cycles like this. So
Well,
why don't we tell our kids who are going on the pill at 14? You know,
well, absolutely. I think the education we had in our schools was more around how not to get pregnant,
yeah.
if I'm being blunt about it. And I know whenever we're doing training, we often have people saying, why didn't we know anything about this? They don't know about the cycle. They don't know about the times that
Mm,
they might be at their most productive, or times when you actually need to be a little bit kinder to yourself if you're following your own menstrual cycle. But generally, what you're told is, well, that's going to be your period. That's what you're going to have for the rest of your life. And what we've
mm.
experienced in this is how many people struggle with menstrual health conditions.
Oh God.
You don't know what's normal because you're
Yeah.
told that's what you've got, that's what you're going to get every single month. But as we've been starting on we've been supporting employers for a couple of years now on the menstruation. We often see people that say that they're really struggling with pain and PMDD and don't know what to do about it, but they don't know what's normal. And for them,
Yeah.
it's normal. And, we encourage people that actually look after yourselves and think about your cycle and your
Mm.
symptoms. There is often something you can do. And this is one of those for people that are taking the pill. Do keep a diary of what's going on for you and do keep
Yeah.
tracking it, because you could be, I mean, you're saying about one of them, I can't remember which one it was that you said, is £8 and the other one's £1.50. But £1.50 plus antidepressants, that's a
Yeah.
different sum. And if somebody's getting struggling with their mental health and being prescribed
Mm.
this, it's like putting a sticking plaster on it, isn't it? If you can access these products, the pills that have got
Mm.
the bioidentical hormones or body identical
Yeah.
hormones, and then
Yeah.
actually you might not need the antidepressants.
Yeah, yeah. And one of the good places to find out about stuff is called the Lowdown. That there's like a TripAdvisor for pills, and it is a commercial site, but they have really good reviews, and that's worth looking sometimes looking things up there because there really isn't this information out there very clearly, other than in my book actually. But it is a real problem to get informed. And one of the things that comes up time and time again when I'm doing these sessions with people is, and this must be the same for you, Deborah, is endometriosis, PCOS. Oh my God, 20% of women are struggling with, it's about 10% each, and heavy periods. And can you stop the heavy periods with a hormonal coil? And what else can you do? And the struggle, and to not, I think the well-being of women have done a special thing about, you shouldn't have to expect a heavy period. You should ask questions if you're dealing with that in a kind of debilitating way every month, and we just shouldn't sit there because we might be able to sort something out. And I know it's really hard to get an appointment on the NHS, but it's so worth asking, looking stuff up, questioning, trying different methods, going in and saying to your GP, let's try three things, let's make an effort. Because I feel that this is so neglected. I'm quite angry actually that it's so neglected.
Well, everybody can go and get your book, but it is that point where we say, don't there is something that you can do just
Mm,
because you put up with it. And, we talk to women and, they're absolutely crippled with pain. And,
yeah.
it takes years before they get a diagnosis. Endometriosis, 1 in 10 women experience endometriosis.
Mm,
Some of the horror stories we hear and we think, how can this be okay? But you don't know what's okay. You don't know what's normal if you've always
mm.
experienced this and nobody's ever told anything. So actually raising awareness is key.
Yeah, yeah. One of the other things that's come up recently, and people will probably have seen in the paper, is the increased number of clots for people who are on the pill for a longer, and the risk of clot and stroke. And that really is worth thinking about if your family are that way inclined, or you're on the pill, on the combined pill in your 30s and 40s rather than when you're younger. And we go on the pill. I mean, we did that survey, and we found that 64% of women went on the pill at school. How well informed were we then? Not at all. And, some of us get on it at school and we stay on it till we're 25, 30, 35. that is a long period of time to be on a synthetic drug. And in terms of, I just interviewed someone who's 32 and had a clot on Yasmin, and there's been 19,000 legal cases against Yasmin for clots and strokes. You don't hear that. And obviously, Yasmin isn't one of the ones that you still get in Britain, but you get Eloine or things like that that are the generic versions of it that have got the same ingredients. So, I feel that there's this kind of secret world out
Mm.
there that we don't know enough about and we should know more about, and we should be advocating for male contraception, male gel, male temporary vasectomies, better coils. I mean, other thing about like coils, fantastic, right? I mean, there's still a tiny risk of breast cancer from coils, but the smaller coils, which are called Kylena and Jades, they've got lower doses of hormones. And they did a depression trial with them in Scandinavia. And they found out that the lower dose coils had much less chance of affecting anyone's mood. Well, you would assume that. But if hormones do affect you, but you want a safe method of contraception or, to control your periods better, then these mini coils, much easier to fit, lower dose, last 3 to 5 years. Why is no one telling us that?
Why aren't they? But I'm being nudged to say, what's the name of your book? I think somebody's already on Amazon.
Oh, luckily I have it here. It's
Ah,
it's all backwards, but everything you need to know about the pill, but we're too afraid to ask. And actually, it's about the coil and it's about natural cycles because a lot of people are using natural cycles. So it's not just about the pill, trans and non-binary contraception, sex. And the other thing is, talking of sex, we have to immediately talk about sex. The pill increases your sex hormone binding globulin, which basically means it chains up your natural testosterone, which women all have. And your testosterone obviously gives you your oomph in bed and in life too. And 21% of women find that their libido goes down when they go on the pill or the implant or the injection or the patch, could be any of those. And that's really important to think, well, wait a minute, I've gone on the pill because I want to have sex. But yet, kaboom, I suddenly don't feel the same. And you sometimes think, is it my partner? Or is it me? Or it might well be your pill.
it
So
might
that's
well be your pill. Yeah. Well, let's
really
delve into
interesting.
some of these questions, Kate, because
Oh,
there's
right. Yes, yes. I can't see them. You read them out. You tell me what you've got coming in.
um my daughter doesn't even want to go on the pill, even though her periods are erratic due to hearing about issues with fertility later in life.
Oh,
Well,
God.
true or false?
Yeah.
I
Um,
don't. To be clear, we can't give medical advice on this, but
no.
I think that one was more of a comment. So whether that's
Right.
something that is a
Yeah.
particular experience. There are other options for heavy periods than the pill. There is medication called tranexamic acid that is non.
Stomach acid. Yeah. Yeah. That helps with the cramping.
Yeah,
Yeah. Molly
my
had that.
daughter has very heavy periods, age 15, and is desperate for something to help. But I'm scared of depression as I have severe depression with progesterone.
Right. Oh, that is really tricky. But is it progesterone or synthetic progestins, or is it progesterone in the cycle? It's very hard to know. I mean, what you can do is there's nothing wrong with trying something for a month. I always think, and telling your doctor that beforehand, and also asking for the safer body identical pills rather than the synthetic ones, and just asking for that upfront because you've got that in the family. Um, I mean, heavy periods, worth investigating, worth tracking. I think, don't know.
Could be another menstrual health condition, but with all this, the thing that is true, I'm taking from this conversation and
Mm,
from experience of changing the way people think and feel about the menopause, actually,
yeah.
that we all have to take responsibility for our health, and that includes being informed and
Mm,
reading up about things and
mm,
preparing to have a conversation with your doctor that you might not have done before. Kate, you've
yeah.
already highlighted that there are lots of different products out there, and that's the same for menopause as
Mm,
well. That,
yeah.
I've heard people saying to me, Over the years, I stopped taking HRT because it didn't suit me. And I go, oh, well, which one were you on? There are
Mm,
so many different
yeah,
options that you don't have to just rely on one. And I think probably for many people, it's usually the second or third that
yeah,
works best for them. So don't sort of worry about having
yeah.
to try
And
different.
another thing really worth bringing up quickly is weight gain on the pill. Because when you look up I've got all the pill textbooks from all the doctors, right? When you look up weight gain, it says weight gain doesn't really happen on the pill occasionally, but it doesn't, it's not a thing. There have been lots of tests showing it's not a thing. And then you find out that depending on what your DNA is, and they've started analyzing DNA and weight gain on the pill, and it's new stuff. If you are genetically programmed to react to synthetic progestins in a different way from someone else, yeah, you might well get some weight gain and some bloating and all those things on the pill. And they don't want to say that on the government websites, because if you've had the words, the pill can make you gain weight on a government website, obviously nobody would ever touch it and we'd have millions and millions of babies. And we really need it sometimes for menstrual regulation for all sorts of reasons. I mean, it can help with endometriosis and all sorts of things. But, it's really worth knowing, if that pill doesn't suit you and you think it's making you gain weight, you might be right. Believe your own truth. You haven't turned into someone else in a month, basically, or 2 months. Journal it, check it out, go back to your doctor and say, this is obviously not the right pill for me. I need, and we aren't doing that. And I've spoke to young girls who've just got, I mean, these are tiny, they seem to be tiny dress sizes, but it's huge for a young girl. I spoke to one girl in my book who just goes from a size 8 to a size 12 when she's about 13. And, also you're putting on weight at that point because you're growing breasts and all sorts of things. But she knew it wasn't her. And she struggled and struggled and then came off the pill back to a normal weight. And so it does happen to some people. And when we did that survey, about 36% of people said they were worried about weight on the pill. And so it is really worth question, question, question. Get the good ones, get the ones that suit you. Try natural cycles and condoms if that suits you. But I wouldn't trust the natural cycles app completely, because it does have a 7% failure rate. So you've got to be careful.
Absolutely. And I can see so many comments and questions. And there is one particularly, Kate, that says, thank you for highlighting this. I wish I'd have known this for a conversation with my daughter. And I think the same truths are the universal truths around, you keep saying, keep your journal, understand what's going on for you. Then you can have a very different conversation with your doctor, can't you? You can say,
Yeah,
this is what I'm experiencing. This is what I've been reading up about. This is what I'd want to do. What do you think? Based
yeah.
on my and maybe even take, because that comment around, I wish I'd have had this information
Mm,
to support my daughter. Take, your mum might want to go with you, or take somebody with you that can ask the
yeah,
questions that you might not want to. But it
yeah.
comes down to that being informed,
Mm,
reading up, and understanding there are many options.
yeah. Believing in your truth, because I think it often gets ignored. Yeah.
And thank you very much to everybody who, I can see some really supportive conversations going on there. Somebody even spelling the names of the pills, because we did go, how do you spell that? And it's like, so thank you very much to you for
Good.
that. And thank you very much, Kate, for joining us today. And we look forward to talking again. And do let us know if there are any other subjects that you want us to cover on the Henpicked Lunch and Learns and podcasts. Thank you very much, everyone.
Bye.